Welcome. In this session, we're going to speak about nutrition. We'll focus on the importance of nutrition to global health, the nutritional state of the world, key nutritional issues, and what we've learned might be done to address some of those issues. By the time you finish this session, you should be able to define key terms related to nutrition, describe key determinants of nutritional status, discuss the burden of nutrition-related problems, review the costs and consequences of those burdens, and discuss measures that can be taken to address some of the most important nutritional concerns. Let's start with some vignettes and then probe some of our students about them as well. Shireen is a one-year-old girl who lives in Dhaka, the capital of Bangladesh. She lives in a very poor family. Shireen was born with a low birth weight, and she's still very short and underweight for her age. In addition, Shireen has repeatedly fallen ill from respiratory infections. Rachel, you lived in Bangladesh, so let me ask you, what role do you think nutrition might play in Shireen's failure to thrive?
Well, if her mother had poor nutrition during pregnancy, that likely affected the nutrition of Shireen when she was born. And if her mother wasn't able or wasn't willing to exclusively breastfeed her for the first 6 months, that would also negatively affect her nutrition.
And what about after 6 months, Vivek? What might some of the nutrition factors related to her failure to thrive be after she was 6 months old? Because she's a year old now.
Continued poor nutrition and not having access to the right supplements or nutrients that she needs.
Right. So one would hope that she might be exclusively breastfed for 6 months, and after that, complementary foods should be introduced in hygienic ways. And it might be that the mother's nutrition wasn't so good. The mother might not have been able to or willing to exclusively breastfeed for 6 months, and the family may not have the income or the knowledge needed to ensure that the child gets hygienically introduced complementary foods with a diverse diet after 6 months, even as she continues probably to breastfeed. Let's look at another vignette. Rachel and her mother live in Mombasa, a port city in Kenya. Rachel had already received her first polio vaccine, was soon to get, she's already received her first polio vaccine, and she's set to get another one. When the children in Kenya participate in polio days or national immunization days or child health days, they also receive supplements of vitamin A. Until about 20 years ago, vitamin A deficiency was related in a number of countries to blindness in children, or xerophthalmia as they call it. But today, as you look around the world, the number of children suffering from xerophthalmia or night blindness is many, many, many fewer. So tell me, Shaylin, if you would, why is vitamin A such an important addition to child health days and to immunization days in low and middle income countries?
Well, in addition to helping with eyesight, vitamin A can also provide children with a boost for their immunity to fight off diseases or illness.
So it turns out that vitamin A is incredibly important, as almost everyone learns in school, for eye health. But at the same time, some very pioneering research more than 2 decades ago showed that vitamin A is also extremely important for the general immunity of people. And vitamin A deficiencies are associated with excess morbidity and mortality in young children from diseases like pneumonia and diarrhea, for example. Let's look at our last vignette. Faiho is a 7-year-old boy in China. He was born at a normal birth weight, and until very recently, he was about average weight for his age and weight for his height. But in the last year or so, even though he's only 7 years old, Faiho has become obese. Emily, tell me, how is it possible in a world in which so many young children are undernourished that we're now looking at a world where at the same time many young children are overweight and obese? What might be happening to cause this?
Well, in some places, foods that are highly processed and have a lot of calories, but not a lot of nutritional value, are the least expensive, so parents might buy those for their children.
Okay, and what else might there be, Rachel?
And as economies develop, typically more processed foods become more readily available in places where they wouldn't have been available previously.
And Shaylin, anything else?
Well, if children are in an urban area as well, maybe they're not getting outside and exercising in an active way that children should be.
It's possible Faya is playing video games rather than engaging in physical exercise, for example. And in fact, in China, a substantial proportion of the young children these days are actually overweight and obese. And in a few minutes, we'll look at some data on that. Now, before launching into discussing the burden of nutritional issues and what can be done to address them, let's look at some of the key terms that people use when they're talking about nutrition and global health. And I'm not going to dwell on these because you'll be able to look at them yourself at your convenience. But I do want to point out that the word malnutrition is used in lots of different ways by lots of different people and not always consistently. In this discussion, we're going to use malnutrition, as noted here, to refer to various forms of poor nutrition. This could include underweight or stunting, but it also could include overweight as well as micronutrient deficiencies. Malnutrition is poor nutrition, bad nutrition, but we're going to also distinguish between undernutrition and certain manifestations of that, and overweight and obesity. Let's look at the next graphic, which also has a few more terms on it. And we're going to probe these a little bit further in a minute, but I will also encourage you to take a look at these yourself. So let's go right on and look at the next graphic. And this one looks at indicators that we use to gauge the nutritional status of young children. First is birth weight, which has to do with the child's weight at birth. And there's a standard definition of low birth weight, and that has to do with a child whose birth is less than 2,500 grams. The birth weight of a child is a very important predictor of the likelihood that that child will thrive. And we'll talk more about what can be done to try to ensure that the child is born with a healthy birth weight above 2,500 grams. We also measure children in a number of ways. Any of you who have children or remember going to the doctor and being measured will appreciate and understand that we look at height for age of the child, we look at weight for age of the child, and we look at weight for height of the child. And we compare them to some standard or reference population. And we're interested in seeing where the children are in terms of these indicators compared to the median of the reference population, with half being below that point and half being above that point. And we have to pay particular attention to children who are substantially different from that median, whose height for age, weight for age, or weight for height is substantially below that median, because this reflects nutritional problems, sometimes acute ones, and sometimes problems that have gone on for a substantial period of time. And we'll be talking as we go on about stunting, which means they're substantially too short for their age. We'll be talking about underweight. They don't weigh enough for their age compared to that international reference. And wasting. Usually we think about wasting. In fact, Rachel, when might you expect to see some wasting in children? Under what circumstances might we see more wasting? We never want to see wasting, but under what circumstances might we see wasting or wasting suddenly kind of emerge in a population?
Wasting often occurs in conflict-prone areas where families all of a sudden lose access to nutritional foods.
Right. So wasting can reflect what they call severe acute malnutrition, just chronic failure to get enough food or enough of the right foods. But also we have to be aware that when we look at droughts or floods or conflict or other humanitarian emergencies, we should sadly expect to see a substantially larger share of the kids who are wasted than we would see otherwise. Now for adults, and let's go to the next graphic, we usually look at body mass index. And this is an interesting graphic of a kind I'm not sure I've seen before. But basically, this allows you to plot where you are in terms of being underweight, in the normal range, overweight, or obese. For adults, what you're doing is you're gauging nutritional status on the basis of what they call body mass index. And you're underweight if your body mass index is under 18.5. You're in the normal range if it's between 18.5 and 25. You're overweight if it's over 25, and you're obese if it's over 30. What we have here is height, and what we have here is weight for kilograms. And the formula is actually noted here, and that is weight in kilograms divided by the square of the height in meters, which I'm not going to trouble you with now. But the main point is, if you plot where people are on here in terms of height compared to weight in kilograms, this tells you whether they're underweight, normal, overweight, or obese. Now, let's look at some key data on nutrition and try to get a sense of the nutritional status of the world, even in a somewhat simplified way. So first, let's look at the prevalence. And regrettably, there's data on all of the indicators that I'm going to discuss, but the data is not always shown according to the same regional breakdowns. So I'll have to ask you to bear with me on that. It's still valuable data that certainly reflects, I think, in a reasonable way what's really going on in the world today in terms of nutritional status of young children especially. And here we see the prevalence of low birth weight by UNICEF region for the period 2007 to 2011. And what we see is that there are two regions of the world which in particular have substantially higher rates of low birth weight than the other regions, with South Asia being remarkably higher, but Sub-Saharan Africa also being substantially higher as well. And again, I want to remind you of the importance of low birth weight to the possibility that a child will thrive. Let's look at the next graphic. And here we see the prevalence of underweight in children under 5 years of age by WHO region. And not surprisingly, given what you just saw, here there are two regions that really stick out for their high rates of underweight in children. Southeast Asia in the WHO region, which includes India and Bangladesh and Nepal, and the Eastern Mediterranean region, which includes Pakistan and the WHO regions, as well as Sub-Saharan Africa. We'll talk a little bit more in a few minutes, but you'll immediately begin questioning, I'm sure, well, what's behind this? What are the causes of this? Aren't Southeast Asian countries better off economically than Sub-Saharan African countries on average? Isn't nutrition related to people's ability to buy food? What we're going to talk about is it is, but it's related to more than that as well. So let's go to the next graphic. And this is wasting in under 5 years, children under 5. And again, the pattern looks very similar. And I should say here, this also includes the quite poor country of Yemen, which is also now, of course, a country in conflict and has often been such a country. But here we see there are, again, three regions in the WHO parlance which really stand out for their relatively high share of under 5 children who are wasted. And remember, wasting reflects severe acute malnutrition and or shocks to the economy and society. And let's look at the next one, and this is stunting. This is children who are too short for their age. And here we see a very similar pattern as well, but some of these figures are truly, I think, remarkable, if not shocking. And that is about 40% of these children in two regions of the world are substantially too short for their age, and as we'll talk about, most of them are irreversibly too short, and many of them will have cognitive deficits related to their failure to grow properly, and most of those will never be able to be reversed. Now, nutrition is central to our health, and the well-being of young children depends in large measure on the extent to which they get enough energy, the extent to which they get enough protein. And there are also 4 micronutrients of special importance when we think about children, especially in low and middle income countries. and that's vitamin A, zinc, iron, and iodine. And let's look at the next graphic, which talks about deficiencies in vitamin A, zinc, iodine, and in this case, it's the prevalence of iron deficiency anemia, reflecting deficiency in iron. And here we're looking sometimes at children, sometimes at the overall society, and sometimes at pregnant women. The data on these are not great. The data on zinc is generally especially limited, but nonetheless, this data is the best data that's available. And what this suggests is that there are important micronutrient deficiencies throughout the world, with substantial pockets, again, in sub-Saharan Africa and South Asia. And these are let me say now that all of these are very important because they have important health effects. Vitamin A and zinc are more closely associated with general immunity than iron and iodine are. And when we think about nutritional deficiencies and micronutrient deficiencies that are associated with child deaths or excess morbidity, excess deaths in young children, the two that are most important are vitamin A and zinc. Iodine is very important, of course, because as children are growing, iodine is essential for developing full cognitive potential. And at the same time, deficiencies in iodine, as many of you will know, are linked with thyroid problems such as the development of a large growth called a goiter. And iron deficiency anemia is very, very common. Almost everyone knows what anemia is and how it reduces your strength. It can cause you to be fatigued and cause you to feel less productive, or be able to be less productive than you would normally be. And there are substantial shares of the world's population that are deficient in iron. Now, once upon a time, we might have talked only about undernutrition, but today we're living in a world in which there are actually more overweight and obese people than there are people who are undernourished. And therefore, in this session, what I'd like to do is talk with you about nutritional issues from undernutrition through overweight and obesity, and try to help you understand both the rates of prevalence of some of these, as well as some of what we've learned could be done to address them. So we're now living in a world in which substantial shares of the adult population, as shown here by WHO region, are obese. And remember, this is a body mass index over 30. I'm not sure it makes that much statistical sense to look at just relatively short period of time and the relatively small changes. But the main takeaway message here is clearly that a substantial share of the world's adult population is obese. And it looks here, and there is better data than this, like this is increasing. Okay? Here we'll look at the prevalence of obesity in adults by sex, also by WHO region. This was in 2014. In fact, we see that the numbers look like they are higher even than in the previous slide. But here that we see a consistent pattern, and that is that women have higher rates of obesity as adults than men do. And there are a variety of factors behind this that we'll talk about a little bit. And now let's look at the prevalence of overweight, including obesity, in children under 5 years of age over a substantially long period from 1990 on the one hand and 2011 on the other. And here we see two things. One is there are regions now, including Europe and including the Americas, as well as in parts of Africa, where a substantial share of under 5 children are overweight and obese, even in some of these places in the presence of a large share of children who are underweight, wasted, or stunted. And we also see that the trend, as everyone surely understands, is moving upward. A larger and larger share of the world's adults and a larger and larger share of the world's children are now overweight and obese than they ever were before. Now, the factors behind this and the reasons why some children are underweight, wasted, or stunted and others might be overweight or obese, are complicated. And UNICEF some years ago developed what they call a framework for looking at the causes and the determinants and the risk factors behind essentially undernutrition. I think this is largely, this is very helpful for thinking about undernutrition. I think it might be a little less helpful for thinking about overweight and obesity. But here what the UNICEF framework says is, let's think about malnutrition. And here, largely at the time, they were thinking, as I mentioned, about undernutrition. What they suggest, and I find very valuable and want to recommend to you as a way of thinking about this, is that we think about the most direct causes. And that's clear. It concerns, do people have, can they get food? Is food available to them? Can they purchase it? Do they know how to consume it in ways that are as healthy as possible? There's a really strong connection between infection and nutrition. As everyone would surely understand, if you're undernourished, you're susceptible to infection. And if you have infections, you don't feel very well. You may not feel like eating very much, and your body, in any case, may not be able to absorb all that you eat. So it's really important that children not suffer from underlying infections. And it's also true that a lot of the health of a young child, nutritional status of a young child, has to do with the caring behaviors of the parent. But if you're familiar with thinking about the determinants of health, we have to think not only about those risk factors and determinants that are most direct, but we also have to think about those that are more indirect as well. So when we look at these, we can ask ourselves, well, if there are deficits here, I mean, why do they happen? Is it because there's something wrong with agricultural markets, or the food doesn't get to the place where people live? Is it because the health services are not very good, or the environment is poor and there's unimproved water, poor access to sanitation, and a lack of knowledge of good personal hygiene? Is it true that the role of women doesn't allow them to be educated, empowered enough, and knowledgeable enough about good caring behaviors? And even here, UNICEF would recommend that we go back to much more looking at the social determinants of nutrition as well. What's the extent to which there's adequate education, both formal and about caring behaviors? What is the extent to which people have access to opportunities to have sufficient income that they can buy a diverse basket of food? What's the extent to which political and economic structures favor such people and allow them to be all that they can be, compared, for example, to the possibility that they discriminate against certain groups because of their ethnicity or because of their occupational status, or because they live in rural areas, they're not educated, or they speak a certain language. So this is very valuable. Again, I encourage you to use this framework for thinking about the causes and the underlying causes of nutritional status, particularly when you're thinking about relatively young children. When we think about obesity and overweight, we also know that there's a complicated set of forces at play that are causing an increasing share of the world's population to be overweight and obese. We know that, as Rachel mentioned, as societies develop economically, they tend to change their diets. They tend to eat more processed foods. They tend to eat foods that are higher in sugar. They tend also to have a more sedentary lifestyle. At the same time, there are broader forces at play concerning genes, cultural preferences, and the marketing and sale of foods globally that are also, in many ways, encouraging less healthy eating behaviors, less physical activity, and contributing increasingly to the growth of overweight and obesity. Now, the costs and consequences of nutritional issues that we've been discussing are enormous. It doesn't take much to understand that children cannot grow physically or cognitively if they're not properly nourished. Second, I want you, as I mentioned before, to focus on a concept that I didn't talk about, but the concept is called the window of opportunity. And here what we mean is there's a kind of nutritional window of opportunity from conception to about 2 years of age, often referred to as 1,000 days, which are really fundamental to whether or not children will grow properly, thrive, and meet their full biological and cognitive potential. Third, it's fundamental to understand that for many of these children, and this is a complicated issue I can encourage you to study further, for many of these children, if they're stunted physically and they're stunted cognitively, they will not be able to reverse those effects, and they will remain that way. And we know that the better nourished people are, the more they meet their full biological and cognitive potential, the more likely they are to go to school, thrive in school, attend school, be productive in school, and become productive adults who, again, have the opportunity to fulfill all of their potential. There are a large number of studies that look at nutritional status, health, and productivity, both historically and in more contemporary terms, and I encourage you to look at them. The health and economic consequences of overweight and obesity are also enormous. These conditions are linked, as you know, with hypertension, diabetes, cardiovascular disease, among other issues. In addition, in low and middle income countries, the average age of onset of some of these chronic conditions is lower than it is in high income countries, and people can live with them for a substantial period of time in what ought to be their most productive years, but with some of that productivity being hurt by the fact that they are not as well as they should be, partly because of these nutritional issues. Now, and there are some important studies that have come out in the last few years, to which I would also recommend to you, that actually tried to quantify the economic costs to several societies as a whole of overweight and obesity, including studies that were done on India and on China. Now, as we address nutritional issues, it's essential to consider interventions in three domains, which are really very nicely articulated in a global nutrition report that came out recently, and the first volume of which came out the year before. And this represented a collective effort by a substantial number of people who work in nutrition internationally to try to look at nutritional issues from undernutrition to obesity and overweight, but also try to look at solutions, not just at the community level, but also those that concern policy, agricultural policy, food storage, et cetera. And that's a very important report that I also very much want to encourage you to take a look at. Now, they suggested that we think about nutritional issues as being categorized into three parts. The first are nutrition-specific intervention, those that have a direct impact on nutrition, such as promotion of exclusive breastfeeding, micronutrient supplementation, or food fortification. The second are nutrition-sensitive. They're sensitive and important to nutrition, but not quite as direct. And these include things like vaccination programs. Keep kids healthy, and that will keep them without infection, that will enhance their nutritional status. Or nutrition programs to enable farmers to increase the yield of crops that they consume, which will increase their nutritional status. And the third has to do with what they call the enabling environment for nutrition interventions. And that might relate to things, for example, such as tax policy or other public policies, such as the efforts that the Mexicans are undertaking now to tax sugary beverages. Nutrition can be complicated, and I think considering potential nutrition interventions is nutrition-specific, nutrition-sensitive, or related to the enabling environment can be quite helpful to you. Now, let's look at some of the most important approaches that we've learned can be carried out in cost-effective, doable, and sustainable ways to address issues of undernutrition. And again, this is very, very simplified. And there's an extensive literature on this that I want to encourage all of you to take a look at. But I'm going to try in a relatively simple way to bring out some of the most important lessons that we've learned. One approach is called growth monitoring and promotion. Among the best examples of this was a very well-known and very well documented and studied project in the southeastern state of India called Tamil Nadu, in which, and in growth monitoring and promotion, young children are weighed, families and often communities together examine the extent to which the children are meeting their growth targets. They identify children who are not thriving, and then through promoting efforts that can be taken to enhance their nutritional status, they try to help families get these kids back on the growth curve. And in some cases, they've tried to do this even in the absence of income gains. And in some cases, they've done this, as I mentioned, not just individually, but collectively as well, and tied it with opportunities for the families to provide food supplements to their children, as well as provide much better information about how it is that families might provide better nutrition to their children through exclusive breastfeeding, hygienic introduction of complementary foods, and more. Two, as we know, as I mentioned earlier, there's an important link between nutrition and infection and between infection and nutrition. And it's very important to try to ensure that children stay healthy, both so that they can stay well nourished, and you'll have a virtuous cycle rather than a vicious cycle that can help take the children down. And certainly one important way of doing this relates to childhood immunization. Some families will not be able to get enough food. They may not be able to afford it. They may not have access to it. And in some settings, it may be important to actually provide the family with food supplements. Sometimes this is done directly, sometimes at health centers, sometimes in other places. Sometimes family get food coupons or food stamps. Sometimes they get food vouchers, or they might get what we call conditional cash transfers, cash payments that they can use sometimes more broadly, but at other times to buy certain food supplements. There's been a lot of efforts globally and within many countries to ensure that children are sufficient rather than deficient in these key micronutrients of vitamin A, zinc, iron, and iodine. And as I mentioned earlier, there are a number of programs for providing children with supplements for those. And Nepal is a very good example of a wonderfully successful program for, in getting out vitamin A. And there are others. And at the same time, certainly those of you who live in high-income countries will understand food fortification is a way of trying to ensure that essential micronutrients are built into the food that we eat. And the world's most successful approach to this has been the fortification of salt with iodine, which has made dramatic progress in reducing the problems that might come from iodine deficiency. And here, there are many, many countries that fortify, and generally what you're looking for is a food that's very commonly consumed, hopefully that's being manufactured by not so many manufacturers that you can't reach them. And governments often work with these manufacturers to fortify these commonly consumed foods to ensure that essential micronutrients get to as many people as possible. At the same time, there's a range of nutrition interventions that studies have shown could reduce childhood deaths by around 15% if these were taken to scale. And here what you see is some of them have to do with the health and well-being of the mother, because a healthy and well-nourished mother who gives birth with a skilled birth attendant and has access to emergency obstetric care is likely to deliver a baby who's of appropriate birth weight and has a better head start in life than a child from a mother who's undernourished, unhealthy, and gives birth at home without the attendance of a skilled birth attendant. So, and we want mothers, of course, to be, there are a number of programs that concern supplementation with vitamins and minerals for pregnant women to ensure that they can be the healthiest mothers that they can be and contribute the most possible to delivering a child that has that head start. At the same time, the World Health Organization recommends that children be exclusively breastfed for 6 months, and that after 6 months, complementary foods be introduced from a diverse set of dietary choices, and that they be introduced in hygienic ways. And in fact, if we looked at the risk factors in greater detail, we would see that one of the leading risk factors for death and illness worldwide is what they call suboptimal breastfeeding. We've talked a bit about supplementation with vitamin A, which has become really a central part of programs in many countries and globally as well. But also zinc is really important, as we discussed, to general immunity. And the World Health Organization recommends supplementation with zinc, especially as an adjunct to what we call oral rehydration therapy when children get diarrheal disease. And we also know that when children fall off the growth chart and they suffer from either moderate or severe acute malnutrition, that we work with families and communities, preferably in community-based approaches, to help them get back on the growth chart, sometimes through things like growth monitoring and promotion and some additional supplementation. In the case of severe acute malnutrition, these children who suffer from severe acute malnutrition may well need therapeutic feeding to get back on the growth chart, and then they may need work with families and communities to try to see, often in very difficult circumstances with relatively poor people with poor access to food, what changes can be made, even in the absence of substantial income gains, to try to see that these kids stay on the growth chart after that. These investments in undernutrition tend to be very good value for money. Studies that Sue Horton, who's a very good economist of health and nutrition in Canada, has done have showed that vitamin A and zinc supplementation, community-based management of severe acute malnutrition, behavior change toward promoting better nutritional practices, iron fortification, and folic acid fortification as examples cost very little per dali averted, and in absolute and relative terms would certainly appear to be highly cost-effective or cost-effective in the settings in which these would be important. At the same time, when they calculate the ratio between how much you spend and the value of what you get in return, deworming, iron fortification of staples, salt iodination, and folic acid fortification, also from that measure turn out to be very good value for money. And indeed, some years ago, there was a group of economists worldwide that has continued to meet called the Copenhagen Consensus. And in the reviews that they've carried out, which they've assessed many different investments, trying to find the ones that are most cost effective for development overall, in each of these cases, a number of nutrition interventions have turned out to be very, very good value for money. Let's look now at overweight and obesity. There are actually very few countries so far that have been able to address obesity at scale. However, there's emerging evidence that suggests that a number of measures are central to trying to do this. One would be to set nutrition and activity standards, set national dietary guidelines, align nutrition goals with agricultural policy. A number of countries are subsidizing foods that are unhealthy for you, while they may be taking policy measures that discourage the growth of foods that are actually good for you. This makes no sense, and it's really important that countries have a team looking at nutrition and the impact of their policies on nutrition. And that team needs to be cross disciplines and across ministries, or one hand might do something, one ministry might do something that helps nutrition, simultaneous with another ministry taking measures that are actually harmful to nutrition. Governments can incentivize healthy eating choices in a number of ways, or disincentivize them, as the Mexicans are trying to do with the taxation of sugary beverages. A number of countries have taken measures to enact legislation to reduce the marketing of unhealthy foods to children. At the same time, if they've taken steps to try to ensure that within schools, students have healthy eating choices. A number of countries, it's important that we engage in a certain amount of physical activity, and yet that's difficult to do in many urban settings in which people are worried about safety. And so it's really important that in cities worldwide, people see safe spaces in which they can engage in recreational activities in order that they might reduce the extent to which they're too sedentary, and that sedentary behavior contributes to overweight and obesity. And we need also to see that physicians and health providers pay much more attention to what really is an emerging crisis, or already a crisis of overweight and obesity. And there are a number of approaches that countries have taken, among them one in Brazil, for example, in which health providers can actually prescribe exercise to people. Now, I hope that by now you have a better understanding of the importance of nutrition to health, some of the key measures of health status, key nutritional problems, and what some evidence suggests can be done to address these problems, hopefully in cost-effective, doable, and sustainable ways, even though on the overweight and obesity side, we certainly have a lot to learn still if we hope that this crisis can be addressed and that the ever-increasing pace of growth of obesity and overweight can be reduced. In the next session, we'll speak about the health of women.